Hello, all. This is Dr. Dheeraj Masapu, and today I'm going to cover the specializations which are more like a gold mine, but at the same time they are risky also because there is something called as a burnout which can happen with these specialties. Let me tell you example. So I have seen some doctors who work for 14 hours, 16 hours in a day. Okay, like some orthopedicians who are having very busy practice, who work for 14 to 16 hours in a day. Okay, and they're absolutely not in any kind of a burnout, absolutely not having any kind of health issues and all that. At the same time, I see some anesthesiologists or some intensivists who work for 8 to maybe 9 hours in a day, but they're extreme burnout. Okay, so what exactly is the difference? If you think work is the only thing, and duration of the work is the only factor which is responsible for the burnout, then you're mistaken. You have to watch this video, and I'll give you examples, and I'll tell you the specialities also. And first, let me tell you what exactly is this burnout. So recently, you would have many of the doctors who are watching the video must be knowing there are some doctors who recently died. Let us not go into that topic. So burnout is one of the reasons for early deaths, and it has been proven by AHA scientific statement in 2021. They say that the burnout can lead to it doubles the risk of cardiac events. And there's a JAMA study also published in 2020, and they say that there is 79% higher risk of coronary disease. Like that, so many studies are there, and it is attributed to the sympathetic overdrive, inflammation, and autonomic imbalance and all that. So not go into that. So let me tell you what exactly happens in the burnout. So what happens is there will be an emotional exhaustion, okay, because of the constant fatigue that they are facing. And there is also something called as cynicism or depersonalization. So they become detached, they become more robotic, they don't react to anything. So if a patient is there in emergency with an MI, then they wouldn't jump and go. They would be more like, okay, MI is done, okay, we'll deal it. So it becomes very regular and routine for them. And then reduced personal accomplishment, so they feel very undervalued in a system. So these are the factors. These are called as Maslow's 3 components, and these are the things usually you see in a physician's burnout usually. Okay, but here in this video, what I'm going to tell is I'm going to show you some of the examples I'm going to quote, so which I have seen in my personal career. One example already I told you, the orthopedician who is like working crazily every day, and at the same time he is not going to burn out. I'll tell you why. So this concept which I'm going to tell now is explained by American Heart Association in their journal Circulation. So what they told is there is something called as a quadrangle where ownership and reward balance it is. For example, if some specialty is having extreme level of ownership and reward is very less, okay, and then they are very likely that they'll get into burnout. Okay, or some specialty has very high ownership, at the same time very high reward, okay, and then they're less likely to go into burnout. I'll tell you with examples so that you understand. So let us come back to the same example which I told before. The orthopedician who is actually working for 14 hours in a day and who's doing multiple surgeries in a day, who has a very good patient base, and at the same time he also has a financial reward, right? So he has extreme ownership and a good financial reward, so the burnout chances are very less for him. That is what AHA is saying. And at the same time, let us take anesthesiologist who is working in a corporate setup, who feels he has very low recognition, fixed income, and even though he's working for 8 to 9 hours or 10 hours in a day, very high likelihood that he will go into burnout. So because the difference is that the orthopedic surgeon would have his power, autonomy, good financial reward. Even though he's working more, he's more safer. Try to understand. So it is more like, it is not the duration of hours or the stress. It is more about this quadrangle and this basis. One more example I would like to tell you. Between a radiologist and pediatrician, I would like to tell you, a radiologist would be working anywhere between 8 to 9 hours in a day, and his income also is very good. A very predictable, lifestyle, non-night duties, and low burnout would be there. At the same time, a pediatrician, if both are good specialties, right? Even pediatrician is working for 8 hours in a day, but here emotionally, sick kids would be there, sick, and the parents you have to deal emotionally more tasking. So here, what happens is the initial salary of pediatrician would be lesser than what radiologist gets. So in the beginning of their careers, if you compare a radiologist and a pediatrician, so what happens is the burnout chances are very high for a pediatrician because of extreme work and less reward. So that is what I'm trying to tell. Another example I would like to tell between cosmetic dermatology versus a neurosurgeon. This is interesting example. Here another perspective you'll get. A dermatologist who is a cosmetic dermatologist who is doing elective procedures, for example, and she has become successful due to some social media handle, and then she's doing a lot of procedures, highly rewarding, and then flexible hours. She is having low burnout. Okay. At the same time, you look at the neurosurgeon who's in a very junior level, is trying to build his practice, who's working for more hours than this dermatologist, night calls. So even though he's a neurosurgeon, there is high likelihood of burnout for him in a junior level. But once this same neurosurgeon, he becomes a senior, he builds his patient base, he builds a good reward for himself by finances and power and influence in that area, then his burnout rate will come down. Okay. Another example I would like to tell: IVF specialist who set up her own setup, and she does procedures there, and the patients, actually, if they conceive kids, then they'll be very grateful for the IVF specialist. Okay, we'll compare her with a very senior pathologist who is head of a pathology in a big corporate hospital. So this particular pathologist work would be monotonous, and then what fixed salary scale ceiling would be there. And so what I feel is this IVF specialist would have low burnout, and the same pathologist whose work has become more monotonous would have a higher burnout. So what I'm trying to tell is, it is not about only the duration of hours or stress. It is more about the reward that you're getting, the control that you have over the system, and the power you execute in that particular system, and also these are the factors which decide the burnout that you see. So basically, all the specialties are a gold mine. Okay, so it largely depends upon individual also, but some specialties by default you take some time to grow. So initial period of that specialty, for example, neurosurgeon example which I told, that neurosurgeon example, in the initial part of career you'll have burnout, but once you build your patient base over a period of 10-15 years, then the burnout level comes down. But a specialty like pathology or anesthesia, initially you might feel good, but later on, once you reach a mid-level career, the growth would be less. There you might feel a burnout. Okay, and a dermatologist whose practice clicked, okay, for her it's a gold mine. But another dermatologist whose practice didn't click, they might go into burnout. So it is more like, so it is not a specialty, even though plays a role. It also depends on how successful you became in career in that particular segment. Is what decides the burnout, is what I feel. So if you ask me which is the lowest risk specialties to get burnout, so if I think about it, any specialty where you succeed little early in your career, like radiology or any kind, if you go into OBG and get into IVF or some in orthocardiology and all those things would be good. So then a very high risk would be specialties which are prone to get saturated faster. Saturated in the sense you would reach a ceiling level of salary, and after that you wouldn't go much in those kind of specialties. I think you will get burnt out very easily. And here I would keep all the pre and paraclinical specialties, anesthesia, ER and all those things would come in this segment, where you end up working more. You have less control over that particular area in your life, because largely you actually work in a schedule and shift based. So when you have less autonomy and power, you will again go into burnout. So see, in my previous videos I recommended these specialties. Here I'm telling little negative is what you must be thinking. See, these specialties will have a very good work-life balance. See, work-life balance is different to a burnout, because based on what I understood from the AHAs, people who enjoy their work, people who actually are doing their work with passion, and people who are becoming successful in their career, are having less burnout. So that is the essence I would like to tell in this particular video. So burning is not only about working hours. It's not about that. It is more about autonomy, ownership, and reward that you're getting from the work. And So if you are in burnout, you are very prone for cardiac disease. Okay, so then you sit aram se. You might be a little confused by the end, by the time you reach this part of the video. Sit down on a paper, you write how much control do I have over my time, how much control do I have over my life, how much reward do I get for my efforts, and can I plan my life around my work. So these are the kind of questions you write down. Okay, and if you feel that you have good control, you have good reward, and then you are not in burnout. Okay, if you feel that you don't have any control over your life, you don't have any control over your reward is very less, you're just working, and then there is a high likelihood that you might enter a burnout zone. So I then you can still modify. There's some specialties you cannot modify. If you're a pre and paraclinical specialty, you cannot modify. But if you're a clinical specialty, then you may, if you're still having no in all these things, then there is a possibility that you can actually come out of it. And even though you work hard, a cardiologist gets up at night 2 o'clock, goes for an MI primary, wouldn't go into burnout just because he is woken up in the night. Okay, he actually enjoys it. He goes there, he saves a life, he takes the reward from there, a reward of patient's life and their family actually praising him, and a smile on the patient's face. So he's not going to burn out there. Okay, rather, if you are a kind of and the same cardiologist, if he gets up and goes there, and then maybe if he's not getting the reward, maybe he'll go into burnout. Oh, this is overall, I'm trying to tell that, so the specialties which I told example, all these are examples. So what I'm trying to tell is, see, most of the clinical specialties, the chances of burnout is there, but largely depends upon what kind of setup you are working, what kind of incentives you are getting for the work you are doing, and how fast you are growing. At any point of time you are saturated in your work, there is a high possibility that you get into burnout. So that's it, guys. I think I hope you got the essence of this particular video. And then if you like this video, then we'll do more videos like this in future. Thank you very much. You watch other videos in the channel, and then I'll see you in the next video. Bye.